As you know, many children, especially in the Pennsylvania suburbs, are heading back to school right now. So how's everybody going to stay safe here? Dr. John Wherry is with us. Doctor, always good to see you. By the way, he's the director of the University of Pennsylvania's Institute for Immunology. Okay, I know, I need your take on this. There's some of these school districts, some of them still are having masks as an optional choice. You don't have to. And we've seen a lot of kids, especially we had a camera out at Central Bucks. I saw quite a few kids getting out of cars and going in without masks on. I have to believe, after knowing you almost a year now, that you're a believer in masks.
Absolutely. Masks absolutely prevent transmission. We know the Delta variant transmits more efficiently. We are going to see an increase in infections in kids when we go back to school, especially without masks. So I worry a bit that we're going to see a big spike, halfway through September as schools open and people are inside without masks.
Yeah, the spike actually could come within 2 weeks, right?
Correct. Yeah, I think there'll be a little bit of a delay, but yeah, probably mid-September.
Yeah. I don't know if you saw this article or not. We'll put up the headline here. There was an unmasked school teacher in California. And in the first couple of days, she spreads COVID to 22 of her students. My goodness. But we're going to see this all across America, though.
Yeah, we will. And it's a very unfortunate situation, but it's not going to be unusual. And we should also note that not only did 22 of the students get it, but 4 of the parents also got it. So we're seeing spread outside of just the kids who are going to school. We're lucky that that happened in one of the most highly vaccinated counties in America, and it could have spread a lot more.
Yeah, I noticed yesterday that Dr. Fauci was on some of the talk shows yesterday morning, and they brought up the topic of booster shots. Should it be 8 months, 6 months after your second dose? This is what he had to say.
What is happening here between 5 months and 8 months?
Well, we're still planning on 8 months. That was the calculation we made. This rollout will start on the week of September the 20th. But as we've said all along, Chuck, in the original statement, that's the plan that we have. But we are open to data as they come in.
So what would you say? What do you think this booster is going to be? 6 months, 5 months, 8 months?
Yeah, I think he said 2 important things there. One, we're going to start rolling out boosters. And for the immunocompromised, maybe people of advanced age, boosters are absolutely going to be beneficial and probably necessary. But the second thing he said is that we're going to watch the data. And I think everybody needs to understand that this is still a very, very fast-moving, fluid situation, and we're all waiting for more data to come out. So we're going to see boosters roll out. We're also going to see new data come in as to how effective boosters are. We're still seeing the vaccines are really preventing severe disease and hospitalization. So while we see a tick up in infections, we're not seeing an increase in severe disease. So the vaccines are still working to a large extent. Okay.
This was an interesting headline. Go ahead and put it on the screen here. It says that getting very ill with COVID-19 is like rattlesnake bite. This study went into. What do they mean by that?
Yeah, I mean, I think they mean that the severity, the sort of discomfort and pain, and also how rapidly things can get out of control is very dangerous. So with a rattlesnake bite, if you don't respond and get attention very quickly, things can get out of control and progress to a point beyond, beyond return, let's say.
Yeah.
With COVID-19, it's the same thing. Some of the treatments we have once you're diagnosed with COVID-19 are very effective in the early day or two or a couple days. But if you wait too long, it's really much more difficult to contain and to get healthy again.
Yeah. Doctor, good to see you. Thank you.
Thank you.
All right. Well, quick break.